So today we'll discuss remaining parts of upper limb, and we're discussing these spaces in upper part of arm that help in communication of nerves and arteries to posterior part of arm and also scapular region. So to make understand them, their boundaries, we can draw two lines. These lines present teres minor and lower line is teres major. And then we draw two vertical lines. And these lines join here as well. So these are two heads of triceps. The lateral one is little head of triceps because it's on lateral side. And this is long head of triceps. So we can see there are three spaces, three compartments. This is quadrangular in shape, so this is called quadrangular space, this one, and its boundaries. Then we can make teres minor is above, teres major below, lately is little head of triceps, and medially is long head of triceps, and it transmits posterior branch of axillary nerve and posterior circumflex artery. Then we have this space. We can see the space so we were just started discussing these different spaces in upper part of arm that help in communication between axilla, structures in axilla and structures to posterior side of arm and scapular region. To understand their boundaries, we can draw two lines and little bit oblique lines. And these lines present teres minor above and teres major below. This is teres minor and this is teres major. Then we draw two lines here, vertical lines, and these lines will also join at the end and make it triangular. So this line, these both lines are tricep heads. So this is lateral line. This is lateral head of triceps, and this is long head of triceps. So we can see it makes four compartments. This is quadrangular space, which boundaries are teres minor above. Now we can make boundaries, teres minor above and teres major below. Medially is long head of triceps and laterally is lateral head of triceps. It transmits the structure. This is posterior branch of axillary nerve and posterior circumflex branch of axillary artery. Then this space is called, it used to be called lower triangular space, but nowadays it's called triangular interval. So this space is called triangular space. This upper space is called triangular space. Its other name is upper triangular space, but mostly they say it triangular space. So how we differentiate which one is interval and which one is space? We can see that this looks more like vertical, like I. So this is interval. So lower one is interval and this one is space. So it's easy to make its boundaries now. Above is teres major and medially is the long head of triceps and laterally is lateral head of triceps. And it communicates with posterior surface of arm and it transmits radial artery and profunda brachii artery. And then this is triangular space. We can make boundaries easily, but important are quadrangular and space and triangular interval. But anyway, its boundaries are teres minor above and teres major below, and then long head of triceps laterally. It transmits scapular vessels, which is here. So these are the boundaries of these spaces. We can draw these lines or we can put our uh, two fingers of one hand horizontally and two fingers vertically, and then we can make out which structure is which. So this is upper triangular space. Attachment of coracoid process. There are three muscles: pectoralis minor, short head of biceps, and coracobrachialis. And there are actually four ligaments, but at least three are important ligaments: coracoclavicular, coracoacromial, and coracohumeral ligament. So now we start with serratus anterior muscle. Serratus anterior muscle is a muscle which does not appear on surface quite well, so it's a little bit obscure from surface, so it's difficult to make its anatomical course. So the serratus anterior is attached to upper eight ribs. It has eight digitations. So each there are eight digitations. They arise like digitation from one rib, but first digitation can arise from first two ribs. So this is on the lateral surface, anterior lateral surface of uh, chest. So if they ask what is the anterior extent of serratus anterior, the anterior of aspect of serratus anterior, some of these digitations reach almost to mid-clavicular line. So this is the anterior aspect of serratus anterior. Then this muscle passes laterally and it passes anterior in front of scapula. Subscapular, it passes in front of subscapularis. So scapula overlies this muscle and this muscle is then attached to the medial border of scapula. So these digitations also have a pattern of insertion. So we can see the direction of pull will be this direction. So it will bring the medial border of scapula anteriorly, and that helps in the action of when we push our arm forward uh, like in boxing. And this is the way to understand its location, how we can identify it. If we see a scapula and a muscle going uh, underneath this scapula, that will be serratus anterior. So its insertion is on medial border of angle of scapula. First two digits are inserted on the superior angle, and then next two along the medial border, and lower four digits are attached to angle of scapula. This is important. Two digits here, superior angle, two digits, then two digits here, then four digits angle of scapula. Why there are four digits? Because this provides scapular rotation. So if we draw a scapula here, and this is spine of scapula, acromion process and spine of scapula. So this muscle is attached here on the medial border. So this is lateral side. And we know trapezius is attached here and here. So trapezius will rotate the scapula, upper part of scapula in this direction, and this direction of pull is like this. So lower fibers will pull the angle of scapula in this direction. So it results in rotation of scapula, and this inferior angle will then may lie at this level, and this rotation helps in abduction. So scapular rotation is by trapezius and by the serratus anterior lower digits. So other function of the nerve supply is long thoracic nerve C5, C6, C7, and it's important aspect in nerve supply as well because its nerve supply passes through posterior to mid axillary line. So where is the long thoracic nerve located? It's posterior to mid axillary line. And what is the importance of that? Because when we do the chest tube, we say it should not be posterior to mid axillary line. So this is the one reason we do not want it to posterior to mid axillary line, because it risks damaging the long thoracic nerve. And its actions is protection of scapula, like in boxing, the arm gets longer because it's pulled forward, scapula rotates anteriorly, and lower four digits combined with trapezius help in abduction and rotation. And it keeps medial border of scapula in opposition with chest wall. If this muscle is paralyzed, this medial border will become prominent, and that's called winging of scapula. And this will become more prominent when we'll ask the person to push the hands on wall and uh, put the hands on wall and push on the wall, then it will become more prominent. That is how you check the serratus anterior integrity and long thoracic nerve. And this is that's called winging of scapula. So this is serratus anterior. It's important muscle in examination because it's quite obscure. It's not as clearly visible. So there can be, if you haven't, you don't know these details, then it may become difficult to answer the question. So this is here again serratus anterior. It goes in the anterior lateral chest wall, and this some it's interdigitate with the external oblique muscle, so they are going in opposite direction. And anterior extent, some of these reach up to the level of can reach up to level of mid clavicular line, anterior extent of this muscle. So now this is other large muscle. This muscle is also important because it's a powerful abductor, and we know that this muscle arises from clavicle, which is anteriorly, that give anterior fibers, and then acromion give middle fibers, and then spine of scapula gives posterior fibers. So anterior fibers, middle fibers, and posterior fibers. All these fibers, these are inserted on the deltoid tuberosity on humerus. We did not discuss this landmark of humerus yesterday because this is located in upper, more towards upper part of humerus on lateral side, and it has shape like this. So we can identify this on bone as well. So it's nerve supply C5, C6, that's axillary nerve. So we should be able to identify this muscle. If I have uh, other pictures, yep. Uh, I mean, we should be able to identify this muscle. This is deltoid muscle, and there is a vein going here, and this groove is deltopectoral groove because this is pectoralis major. and this is deltoid. So this is deltopectoral groove, and the cephalic vein passes in this groove. But we should be able to identify anterior from middle fiber. If we put an instrument here like dissecting forceps, we can separate anterior fibers from middle fibers. Similarly, posterior fibers we can separate from the middle fibers as well. So this is posterior side. We can put an artery here and we can separate it. So we should be able to identify all these three parts. If they just ask the structure here, a separate structure, what is this structure? What is structure A? These are the posterior fibers of deltoid. Deltoid may not be appropriate posterior fiber. Similarly, anterior fiber of deltoid, middle fiber of deltoid. What's nerve supply? Posterior branch of axillary nerve. Axillary nerve is okay, but we need to be more precise. So this uh, action is the middle fibers. They are powerful abductors, but they cannot do abduction on its own. Supraspinatus starts abduction and does abduction up to 15 degree, and then deltoid causes the abduction. And anterior fibers cause flexion because they are located anteriorly, flexion, and some medial rotation, and posterior fibers cause extension, some lateral rotation. So this is deltoid muscle. To assess it, if we have to assess on a normal person, we bring their arm to a little bit 30 to 40% on side, and then ask them to abduct against resistance, and then we palpate muscle. We always palpate muscle when we check their powers. Only checking power is not enough because it may be due to some other muscle. So lateral abduction for middle fibers and flexion for anterior fibers and extension for this. So you can check all these fibers, but at least you should check middle fibers. So let's finish the muscles and then we come to veins. So other important muscle of back is latissimus dorsi. This is also large muscle of upper limb, but it's mostly located on back, but it uh, acts on upper limb movements. So this start from T6. So lower six thoracic vertebrae, uh, whatever level is from T6 to T12. Uh, Spine of lower six thoracic vertebra, and then lumbar fascia. This white structure is lumbar fascia. We can see lumbar fascia is attached to spines of lumbar vertebra as well as sacral vertebra. And this muscle arises from lumbar fascia and then also arises from iliac crest. And then it passes here. This is free edge here, and then it contributes to formation of a triangle. But this is the latissimus dorsi. So we can see some part is overlapped by trapezius, which is this muscle. So upper fibers go horizontally. This helps in identification. Lower fiber less vertical, middle fiber and lower fibers more vertical. And then it passes along the posterior wall of axilla. It makes the passes along the posterior wall of axilla and makes part of posterior wall of axilla, and then it's inserted to the floor of intertubercular groove on humerus. So these are also its region, less important lower foreribs and some fiber from spine of scapula. But if we mention this, that should be enough. But we can obviously to complete the answer, it's the lower foreribs as well. Nerve supply is thoracodorsal nerve. Thoracodorsal nerve we know is the branch of posterior cord of brachial plexus, and it runs with the uh, thoracodorsal artery. We discussed one artery yesterday. This is subscapular artery, and after it gives this branch, which is a circumflex scapular artery. This is then thoracodorsal artery, and thoracodorsal nerve passes with this vessel, and then it enters the trapezius. So when we do axillary lymph node dissection, this makes the posterior boundary. We do not to go beyond this nerve. That's the posterior boundary of dissection. So thoracodorsal artery and nerve pass along the pass over from axilla over subscapularis and reach to this muscle.